I became pregnant in 2014 and things felt pretty normal until I was about 18 to 20 weeks along and I got a bad cold. I didn't know what question to ask when I had this intuitive feeling that something was different about her. At 36 weeks, I had an ultrasound and the baby had microcephaly, which is a disproportionately small head. And they said, we'll just have to wait and see. When Anna was born, she only weighed 5 pounds and she was completely silent. She failed her in-hospital hearing tests. 10 days later, when we brought her to the pediatrician, he said, I want to test her for a common but little-known virus called CMV. And I knew that I had never heard those letters before. When I went home and looked it up, I was shocked by its prevalence and its spectrum of symptoms that could be progressive. I was scared and just really taken aback that nobody had mentioned that it resides primarily in the saliva of toddlers, and having a 2-year-old at home had made me high risk. When we received the results, 3 days later, she was positive for congenital CMV.
CMV, or cytomegalovirus, is a common cold virus. It's everywhere. CMV is most often a harmless virus. The big exception is when a pregnant person catches CMV. Then the virus can be transmitted through the placenta to the growing fetus. We call this congenital CMV, which means born with a CMV infection. There are some pretty serious long-term effects of congenital CMV, the most serious of which is pregnancy loss. But most often we see children born with hearing loss and at higher risk of developmental delays. Congenital CMV impacts 1 in every 200 babies born in the US. That's more than Down syndrome, fetal alcohol syndrome, spina bifida. It is extremely common. CMV is spread through bodily fluids, especially saliva and urine, and we see it most commonly in young children who attend daycare. After a child gets a CMV infection, they can spread the virus through their bodily fluids for months. So people who work with young children, daycare workers, or who have young children, especially parents, need to really be on the lookout to prevent CMV infection. Everybody should be working to prevent the spread of CMV. It's especially important to do this for someone who is thinking about becoming pregnant or who is pregnant. Reduce your risk of catching CMV by doubling down on hand hygiene. So washing your hands diligently after changing diapers, after you wipe a nose, before touching your mouth, before eating. Avoiding sharing sippy cups or straws, utensils. Don't share toothbrushes or clean the pacifier with your mouth after it falls on the floor. There are lots of studies that show that these risk reduction methods work to lower one's risk of catching CMV.
Knowing the couple of easy hygienic measures that we can implement during pregnancy is not so different than the things that we already do. 1 in 5 babies born with CMV will have lifelong challenges. We're missing the opportunity to give our children access to their fullest potential. We love many of the things that CMV has sown into our daughter's being, but it's important to prevent CMV because it can be life-threatening.
Once you know about CMV, then you can do your best to try to prevent it.